Governor Brown is lowering the coronavirus risk level in 16 Oregon counties. These changes will take effect Friday. Here in the metro area, Clackamas and Washington counties will move down to moderate risk. That's down from high risk. That means churches and businesses like restaurants and gyms can allow more people inside. Multnomah County's risk level hasn't changed. That is still at high. Now, those lower risk levels come as we continue to see case numbers on a downward trend all around the state. While it's not enough for Multnomah County's restrictions to ease again, a lot of other metro areas will. I sat down with the lead health officer for the Tri-County area, Dr. Jennifer Vines, to talk about the trends, concern about COVID fatigue, and opening life back up to some semblance of normalcy.
It's tricky. It's the prevention paradox. So, cases go down and people feel maybe a little bit more relaxed around some of their personal behaviors or some other choices that they make. And that can cause kind of a cycling of an increase and decrease in cases. We haven't actually seen that very much in our area. People have really seemed to stick with the precautions. And I would urge them to continue to do that, because what it's doing now is buying us time to vaccinate, which is really the public health win here. And I think really are to get back to something resembling normalcy later this calendar year.
And speaking of that, just an ounce of, feeling normalcy, some kids starting to head back to hybrid learning this week in the Tri-County area. What's something that you want parents to keep in mind here, and anything they should be looking out for when sending their kids back to school in person?
So schools, as any parent knows, kids bring home all kinds of things from school. I think the COVID precautions and the plans in place to get kids back in school are strong. It may be bumpy at times, but I think we all agree that kids need to be in-person learning, especially our youngest. So being able to roll with that balancing act of having our kids, youngest especially, learning in person versus that disease risk transmission. I think there's a trade-off there, and I would really encourage families to figure out where they personally land around that trade-off, and then do what they can to manage it according to their circumstances.
Okay, Ashley, so big takeaway here is that there is room for optimism, but that optimism comes with the hard work that we've all been doing to wear masks, social distance, and take those precautions against the virus.
Yeah, absolutely. Brittany, I heard her mention in that story there, vaccines are the real ticket to getting back to, I guess, normal. I say that in quotes. But did she offer any insight into that?
Yeah, Ashley, we're waiting to hear more about the Johnson & Johnson vaccine. And if that one's approved soon, we could start seeing doses in the first half of March. That's a big deal, right? Dr. Vines is very excited about that, especially the fact that it's a single dose vaccine, but it does add some complexity to the mix here, especially for public health and their messaging. She says public health and healthcare systems will need to be clear about how they're using the J&J vaccine and who it's targeted for.